Hi, everyone. This is Laurel with Laurel Buys Houses, and today I'm with Matthew Crooks from Adopt an Elder Foundation. This is a great foundation that our company definitely supports and works for and that has done fundraising with. So first of all, welcome. It's good to see you again, Matthew. How are you?
I am fantastic. I'm so excited to be here with you.
Great. So, here at Laurel Buys Houses, we're very excited to support Adopt an Elder. We know a lot about what you guys do, but what I want to talk to you about right now is what kind of resources are available to low-income seniors, and kind of what do you guys do?
Okay. Well, first of all, I would like to salute Laurel Buys Houses for your long-term support of Adopt an Elder Foundation. So the Adopt an Elder Foundation is a local Sacramento only group. We're an all volunteer group. There's no paid staff. Our overhead costs are about 95% of any donations go directly to a low-income senior in Sacramento. And I want to actually quickly identify or give a definition of for Adopt an Elder. What happened was in the early 2000s, everybody in the senior health world started realizing that the Social Security income for a lot of elders who were in the the lower echelons were not enough any longer to provide dignified care, except if you went into a nursing home under Medi-Cal. And so what we're really talking about is people who have worked their whole lives and their Social Security income is above what Medi-Cal would say is, you're fully covered, but they still don't have enough money to actually afford dignified care in the community. And one of our major philosophies is that we want to avoid institutionalization of any senior if they don't need it. And what was happening before was that people who perhaps were, $200 or $300 above Medi-Cal limit were forced to go to nursing homes for long-term care when they could have gotten community care if they could have afforded to pay it. And so that's really the crux of our whole philosophy, is trying to prevent institutionalization of seniors when their care needs don't require it. And it's just because of the Medi-Cal rules and rates. And so all we really do is we're a whole group of volunteers who just raise money to adopt seniors who are above Medi-Cal limits, so we can prevent them from going to nursing homes when they don't need it.
Great. I got that. Now, how long has your organization been around?
Well,
what's the history of it?
I think it was started in about 1999. I've been involved on and off on the board as different roles. I was president for 5 years, but I was on the board in 2003. And
Okay.
and it was a couple years before that.
Okay.
Well, we've been around, and like I said to you before, we're a completely local, all volunteer group here in Sacramento.
Okay. Now, what do you guys actually provide to the senior? So, what is the program? What are they getting? And how do you decide who gets what?
Okay. So we get referrals from all across the hospitals, skilled nursing facilities, placement agencies, all from the whole community. And these are people who, what they're referring to us is people whose what they need exceeds what they can afford, basically. And so we've broadened our range a little bit. We originally only would adopt seniors who needed to be placed into a care facility, like a board and care, assisted living, etc., to prevent going to nursing home. Now we actually are, we broadened our mission a little bit. So now we can pay for in-home care. We also can pay for some meals served at home, chore services, that type of thing as well.
Okay.
So
and is this like you're just helping them for a short time, or?
No, in fact, when we get a referral, we do, of course, want to financially reconcile and make sure that our hard-earned money is being used, appropriately. So we do ask for bank statements, 3 months of bank statements to show their actual income and show their expenses. And as long as they're in line with our criteria, then when we vote to adopt them, we adopt them for life.
Okay, for life.
For life.
So even as they need more stuff and things like that.
Well, no, I mean, Laurel, we can only do what we can do. And so, like, if they're, if people's situation were to change and they truly need skilled nursing facility, then, we do have to facilitate them going to the appropriate level of care. But if it's just their care levels going up, then we will either negotiate with the care facility, or we also could vote to up our monthly adoption contribution to that senior.
Okay, great. So I know that one of the things about your organization is that you guys, there's research that shows how to help seniors, and that's caused the philosophy that you have.
Yeah. And what was amazing to me too is that recently the county of San Diego did a long-term research for a year and a half of just assessing and trying to figure out what were the causations for elders, people who are above 55, who became homeless in San Diego County. And, we hear so much on, the media about how it's more about mental health issues and about drug and alcohol issues. But what they found in San Diego County was that only 1 out of 5 older adults in San Diego County became homeless because of mental health or alcohol and drugs. 4/5 of them were because their retirement income or their income was not enough to keep them in a stable housing when they could easily handle it by themselves. And then they went even deeper, and they asked people about their actual financial income, and then what was it that caused them. And what they found was that the average older adult in San Diego County that was homeless were only homeless because of a $300 a month shortfall. If they'd had $300 more, they would have been fine in wherever they were before. Now, originally with Adopt an Elder, 20 years ago, our normal adoptee rate that we would sponsor somebody was around $200 a month. Now we're up into the 400s because of the cost of providing care, the cost of staffing, etc. But it's shocking to me to think about, extrapolating that to LA, San Francisco, other high homeless rates. Those people who are over 55, if we just gave them all $300 a month, we would dramatically decline homelessness in all across California. And really, that's not that much, considering that the one ride to the ER in an ambulance that the state or county will pay for because of an emergency or something going on is around $1,400. And if we were just to contrast and use data showing how in one way we pay, with no limits for ambulance rides, for example, or emergency rooms. Okay. If people were just safely in their own home, it would be so much less expense on taxpayer dollars. And, this really is a public policy issue.
Right. Now, how can people in the community, how can other business owners, other people support your efforts and contribute?
Oh my gosh. Thank you for asking that. Well, first of all, we just want everybody to know about us. And so that if a business owner, for example, is seeing an elder who's, camping in front of their house, call us. So first of all, the biggest support we can get is just to have people communicate to us about the different needs that they're coming across. We also, because we're an all volunteer organization, we would love to have any and all of you join us. We need board members, we need volunteers, we need ambassadors. We would love to have any and all of you call us up. And we really want to, because we're very focused in on a lot of social workers and a lot of healthcare people. We want to have everybody in the whole community, because everybody has a grandparent. And we're, that's the one thing that brings us all together in this community, is that it's not just social workers and nurses and healthcare people. All of us have grandparents that may or may not be in need. But I think,
or neighbors, yeah.
Or neighbors, exactly. And so we really want volunteers. And of course, we would be so grateful to have anybody donate any dollars that they can for this cause.
Awesome. And we do try to give you some support administratively, as well as we contribute financially to you guys.
Absolutely.
So I want to just give everyone a challenge. This is a great local 100%, well, 95% goes directly to an elder. And once they adopt someone, they never let them down. They're there to support them and keep looking for resources for them in the community as well. And it's a great place to volunteer and make a difference one person at a time, So we really appreciate you, Matthew, for coming on and letting us know about this. At Laurel Buys Houses, we really, really care. And if anyone has any questions or comments, even if it's not on the live show, we're going to be monitoring it. And of course, especially if you'd like to contribute, we'll be happy to get right back to you. So thanks, everyone, for joining us on Facebook Live. We really appreciate your attention and your community spirit.
Thank you. Thank you, Laurel, and thank you, the world, for your support.